The views and opinions expressed by the host do not necessarily reflect those of the company and its management. Furthermore, the views and opinions expressed by the guests do not reflect those of the hosts, the show, the management, or the network.
This podcast episode is brought to you by Montesa Medical Group Aesthetic Center, Advanced Dermatology, Age Management, and Plastic Surgery. Timeless beauty, safe, and worry-free.
Hey, what's up? Welcome to Bloomer Babe Podcast. Kamusta kayo, babes? I am so excited for today's episode. Makakasama natin ulit ang owner ng Montesa Medical Clinic, si Dr. Anna Montesa. If you've listened from our previous episode or interview, we've talked about beauty, self-care, and anti-aging treatments. I have to invite her again. But this time, we will talk about whitening treatments that are super in demand. So, Doc Anna, hello.
Hello.
Welcome back to the podcast.
Welcome back to Montesa Medical Group. Sana
Finally,
maging regular ang pag-visit mo sa akin.
yes, we will. Finally in person. So, how's everything, Doc?
Okay naman. Very happy kami to have you here in person.
For this episode, I want to talk about whitening treatments. So, para sa mga listeners or sa mga viewers, mga millennial girlies dati na nabiktima, walang sawang nagpahid ng mga lotions at nagkuskus ng kojic or ng mga papaya soaps noong 90s. This episode is for you. So, we will talk about what are the treatments that are in right now, pinaka-affordable, pinaka-effective, and of course, still the safe ones. So, before anything else, I'm just curious, Doc, may question lang ako. Why do you think Filipinos are very interested to, or very, I can say obsessed, to lighten their skin up?
So, ako sa tingin ko, maybe kung ano talaga yung wala sa kanila, yun yung gusto nila. Okay? So, usually, yung mga Filipinas na with lighter complexion, actually gusto nila magpatan eh. Ayaw nila ng whitening. But for those Filipinas na nasa type 4 skin, medyo tan sila, yun yung mga gustong magpaputi. And especially, syempre, na-colonize tayo ng mga Spaniards and Americans, gusto natin yung skin nila. When yun namang mga Americans, gusto nila yung tan skin natin.
Yes, yung morena skin.
Here at Montesa Medical Group, we've got innovative approaches for your physical look. Montesa Medical Group, results are mental, safe, effective, and worry-free. Enjoy your quiet luxury, a timeless beauty. Here at Montesa.
Can you walk us through, Doc, yung mga different treatments na meron kayo and how will we know kung ano yung para sa amin?
So, siguro ikakategorize ko yan. For patients na gusto talagang, for example, they have a problem ng hyperpigmentation or melasma and gusto talaga nila na immediate yung effect. Halimbawa, they have a event na gusto nila maganda kaagad yung skin nila, we recommend the Montesa Whitening Peel. So this is a macro peeling, a deep peeling solution na the doctor is going to apply the medicine on your face. Wala siyang sakit unlike other ordinary peeling kasi lahat naman ng chemical peeling may hapde. This one, all natural ingredients siya, wala siyang hapde, wala siyang sakit. We're going to apply the medicine on your face. You're not allowed to wash for that night. Tomorrow ka pa allowed to wash. And then after 2 to 3 days, makita mo macro peeling na siya. Hindi siya mangingitim, maputi yung peeling niya. And then ang maganda sa kanya, kung saan yung pigmented area or kung saan yung melanin, nandun siya doon siya pumupunta. Unlike other peeling, pantay lang, parang nag-brighten lang. So minsan, yung mga pigments mo, mas nag-glidan lang, hindi talaga natatanggal. But with Montesa whitening pill, kung saan yung pigment, saan yung melanin cells, doon siya pumupunta. So, mas nagpipil yung area na yon, mas nagagamot. So, guaranteed siya to remove all pigments. Okay. Ang problem ko lang, minsan kasi yung tinatawag natin na melasma or pecas, nasa dermal area na siya. So, yung epidermal layer mo, yung outer skin mo, nag-peel na siya, syempre, meron pa rin mancha yung ilalim ng skin mo. So, aakit siya. Maybe we have to repeat after 6 months or after a year. Alagaan mo na yung skin mo para talaga ma-remove natin yung pigment. But for those persons na PIH lang or acne marks lang, mas madali siyang tanggalin. When we're talking about pigment, hindi yung scarring na malalalim.
Oh. So, mild siya. Pero gano'ng katagal ang...
So, usually, yung peeling mo is 1 to 2 weeks. After 2 weeks, you need to come back for consultation para ma-assess natin yung skin mo. And then, wala ka talagang sun exposure for 3 months.
3 months, Doc?
Actually, 3 to 6 months para isipin mo parang baby skin ka and then expose mo yung skin mo under the sun. Siyempre, lalo kang magkakaroon ng pigmentation.
Tapos to kayo mag-apply mo?
Oo, doctor's procedure siya. So, ang maganda sa kanya, walang sakit, but of course, mafe-feel mo may konting warmth at saka tightening. Tapos magpipit siya for 1 to 2 weeks ng maputi para matagdag yung mga hyperpigmentation. So, we recommend this if you can promise to us na wala kang sun exposure. And gusto mo talaga maganda kagad yung skin. Okay? We can also do this for patients na may acne. Tanggalin lahat ng mga pimples nila.
Kahit may active po.
May active. So, at tanggal. Ang magiging problem na lang is yung tutubo afterwards. So, syempre, if your concern is pimple, tanggal lahat sila, but we need to maintain yung mga tutubo pa sa'yo na pimples. Pero for those persons na very active lifestyle, hindi mapapromise na hindi talaga magpapaaraw, syempre, meron din tayong treatment for that. We have the whitening lasers na we do every 4 to 6 weeks. So, mas manipis, it will target the melanin cells also. Tapos, para ma-disperse siya every time you do the laser. And via laser to itong whitening laser. Pigment specific, para rin matanggal yung mga hyperpigmentation.
Ito, Doc, yung sa laser naman, meron po bang downtime? May peeling
Wala
din?
siyang downtime, micro-peeling, di makikita.
Okay.
Tapos, syempre, di mo kaagad kita. You need to have 4 to 6 week sessions. Sometimes, depende rin kung gaano ka lalim yung peeling mo, yung pigment, kung ano i-recommend na number of sessions for you.
But can we put makeup above?
Siguro mga after 24 hours.
Okay.
Walang swimming and ano tawag doon? Hot tubs, sauna. For 24 hours. Ganun. Siguro for those who have very sensitive skin, mild reddening lang, o mild flushing, na mawawala din after a few hours. So may mga ganun din kind of treatments. So we have Rev Light and we have laser genesis.
Okay. Dok, anong difference ni Rev Light with laser?
Actually, pareho silang NDIAG laser. Pero yung laser gen, more on pores, fine lines. Pero natitreat din ng laser gen yung yung merong mga rosacea, yung nagpa-flush yung skin. Yung very dilated yung capillaries nila. Very effective siya for rosacea patients. Makita mo mag-matte finish na siya. Tapos makokontrol yung redness. The Rev Light is more for whitening. Meron siya more for whitening. Kasi yung laser gen more for everything. Pores, fine lines, at saka yung flushing. And in the process, may whitening na rin siya. Brightening. But for Rev Light, kaya din niya yung pores, fine lines, pero pwede niya i-target mismo pigmented areas. So, less siya sa flashing.
Okay. So, yung isa, Doc, kaya niya ba yung mga maliliit na veins? Okay.
yung cuteral laser.
Chika.
Meron din kami cuteral laser vein removal. Kung
Mm.
meron na talaga mga broken capillaries and telangiectasia, yung mga, or meron din mga leg veins and sabi niya, varicose veins, spider veins, kaya
Okay.
ng laser vein removal. Kasi we don't advocate the injection.
Mhm.
Kasi ang problem is, kapag sobrang nipis, mag-extravasate din sa surrounding area. So, nagkakaroon pa ng necrosis. Yung gamot pumupunta sa labas.
So, parang lumilipat lang siya, Doc?
Hindi mismo kasya yung nipple mo eh. Kasi sobrang nipis ng mga spider veins. So, sa labas lang din. So, baka magkaroon ka pa ng necrosis sa skin mo. And of course, no chances for allergy kasi laser siya, walang in-inject sa yung gamot.
Mhm.
And no chances of going to the heart.
Mm-mm.
Kapag bigger veins kasi, when you do sclerotherapy, may tendency to go to the heart.
Mhm.
So, walang chances na ganun kung laser vein removal. And, mas permanent siya kasi hindi na siya bubukas ulit.
Mhm.
We also have cuteral laser vein removal. Ang maganda sa kanya, it will target the spider veins, yung mga varicose veins, even with the face, di ba minsan may mga broken capillaries, kayang-kaya ng cuteral laser vein. Ang advantage sa kanya, we don't advocate sclerotherapy kasi may chances for allergy, kasi medicine, and then kapag sobrang nipis ng vein, like spider veins, hindi mismo pumapasok yung needle. So, ang tendency, yung mga medicine, pumupunta lang sa labas.
Mhm.
So, nagkakaroon ng cases of necrosis ng skin.
Mhm.
Unlike with the laser vein removal, mas na-target namin yung veins itself. So, no chances for necrosis. And, no chances for the vein to open up again. Kasi kapag minsan, hindi masyadong di ba ang complaints ng mga patients namin during those times, bakit daw bumalik na naman, bubukas ulit yung veins ko? Kasi nga hindi masyadong na-sclerose.
Mhm.
So with the laser vein, once na tinamaan siya, tanggal na talaga yung varicose veins.
Pero, Doc, mayroon talaga siyang possibility na in the future.
In another
after-
area, for veins, kung talagang sobrang extreme exertion ka ulit, standing, or yung mga nagbuntis,
Ah.
nag-weightlifting,
Mm.
yung sobrang abuso ulit, or yung mga nagmamarathon,
Mhm. Oo nga. Kaya pala they're wearing mga compression
so dapat naka-compression stockings.
Okay. Sige, Doc. Yung sa treatments naman, Doc, ngayon, ano yung pinaka-popular na whitening treatment?
So, ang advice ko is, huwag dapat over-the-counter medicine. Okay. Dapat laging may alaga ng doctors nyo. Kasi, since whitening yan, usually we're applying medicine on your skin na sometimes mas nakaka-irritate pa. Of course, kapag nagkaroon ng irritation, reddening, magkakaroon ng post-inflammatory hyperpigmentation. Mas pangit pa kung hypopigmentation, yung namumuti. So, mas mahirap pang bumalik yun sa dating color mo. Okay? So, siguro pinaka-popular with your doctor's advice, yung madami ngayong nag-aano sa amin ng intimate whitening. Kasi siguro maraming nang naka-sleeveless.
At summer.
Gusto nila flawless yung underarms nila. Iba nangingitim yung neck, nangingitim yung inguinal area. Sometimes pati yung mga, ito yung mga singit nangingitim. So, and since sensitive area sila, hindi kaagad sila nakakakuha ng tamang over-the-counter medicine to address that. Minsan lalo pag nai-irritate. So, they go to their favorite doctors para i-address yung mga areas na yun. So, we have the intimate whitening na kahit mild siya, makikita mo kaagad. Hindi rin siya macro-peeling na kasi usually pag macro-peeling, medyo matapang yung medicine, baka ma-irritate yung skin. With the Montesa whitening pill, ina-avoid namin yung mga intimate areas. Kasi nga, peeling yun eh. So for the intimate whitening, meron kaming another kind of peeling na mild siya, that we have to do it siguro mga every 3 or 4 weeks, several sessions para mag-white.
Okay. So, you have to do it dito po sa clinic. Okay.
Tapos, syempre, mag-advise to avoid irritation on that area. Kasi any irritation, pwede naman tawag ito, mag-darken.
Sa mga treatments yun, Dok, mga laser treatments, ano yung pinaka, let's say, mabenta?
Laser treatments with whitening. Syempre, yung red light na kayo. Laser genesis.
Sa drips, Dok, meron ako nakita na
Oo. So, yung with the IV drips, actually popular din siya nowadays. Kasi hindi lang siya for whitening, but also for health and wellness. So, syempre, ang dami ng stress, detoxification, anti-stress siya, anti-cancer pa siya, will increase your immune system para hindi kayo ubuhin or sipunin. We advocate we have the Snow White IV drip, that's for whitening. We also have the detox IV drip and the anti-stress IV drip. Parang,
all around stress.
Oo. Merong parang strength enhancer para lumakas. Kasi diba parang pumupunta lang dito para mag-detox at para lumakas ulit. After a day's work. Ganon. At saka yung mga nagpa-marathon, gluta, nag-strength enhancer, nagdi-drink. Para malakas sila. Di ba usually, kapag hindi ka well hydrated, tapos nag-marathon ka, nagkakaroon ng lactic acidosis sa muscles mo, mas nagka-cramps ka agad. So, para maganda yung...
So maganda rin siya sa
mga athletes.
Yes. So, para ma-relax yung muscles.
Tsaka well hydrated ka.
Meron po ba kayo, Doc, na mga bawal na magpa-drip?
Syempre magbawal kung may kidney disease na, may liver disease, lahat naman ng meron ng sakit, may mga chronic illnesses, bawal na kagad. Pregnant and breastfeeding moms, eliminated na sila kagad. But, parang pwede siya sa lahat. Of course, dapat 18 and above.
And then, while nasa session ka or papadrip ka, Doc, meron ba mga bawal? Kasi narinig ko na, of course, bawal ka magpa-araw, pero bawal ka daw magkape, bawal ka daw mag-tsaa.
Parang hindi bawal magpa-araw. Actually, protection siya against skin cancer. But hindi siya sunblock. So, if you want the brightening side effect of the IV drip, so, dapat mag-sunblock ka kung magpapa-araw ka. But hindi siya yung whitening medicine na bawal ka magpa-araw. Na nagpa-araw ka, mas lalo ka mapapahama. Actually, it will protect you from the sun. So, hindi bawal magpa-araw. Hindi ka lang magpa-brighten. So, for those persons then na hindi ma-promise na magpapa-araw, nag-IV drip sila para for good skin
overall
protection. Oo. Pero nagpaparang pa rin sila. At least, hindi sila magkakaroon ng mga dark spots or hyperpigmentation or yung mga pangit.
Exposed
at least may protection. Pero hindi sila mag-whiten. Magtatan sila as usual. So, dapat pa rin mag-sunblock.
Is there a recommended interval, Doc? Halimbawa, kapag-gluta session ako, dapat ba every once a week?
So, tataas siya sa blood level mo. So, dapat meron ka pa rin oral everyday.
Okay. So,
and then, bababa rin siya ganon. So, dapat once a week.
Okay.
If you want the whitening. Once a month, if you want just a detoxification. And kung strength enhancer, kung halimbawa very stressed ka, pwede rin twice a month.
Isa pa, Doc, ito medyo talagang may ito sa social media. Korean glass skin. So, marami ang gustong magkaroon talaga ng super shiny, super dewy effect ng skin. Is there a treatment or recommendation from you?
So, para ma-attain yung Korean glass skin, dapat muna walang pigmentation. So, na-address ko na halimbawa yun, nagawa ko na yung Montesa whitening pill, na-erase na namin yung pigmentation niya. Usually, mga patients ko nagme-maintain with Revlite or laser gel. Para dun sa parang Korean glass.
Yes.
And of course, increase moisturization. Yung ultra white European facial namin, more of moisturization, tapos wala siyang harsh ingredients, walang stinging, walang redness, and then complete siya with the PDT light for skin cleaning and brightening.
And yung Rev Light, Doc, every when?
Every 4 to 6 weeks.
4 to 6 weeks.
So ina-alternate namin siya with ultra white European facial. Bawa, Rev Light ka ngayon, after 2 to 3 weeks, ultra white European facial, and after 2 to 3 weeks, Rev Light.
Okay. Okay. Sa tingin niyo, Doc, ano po ba ang mas effective? Laser treatments or yung mga whitening mga creams or yung peels?
So for creams, so pinaka-minimal na pwedeng gawin ng isang tao is the medicine, yung creams, kasi take home yun eh. Even with the lasers and peelings, dapat meron pa rin silang maintenance na take home meds na creams para dire-diretso yung pagganda at saka pagkaroon ng renewal ng skin nila. So even after skin peeling, meron kang creams. After with Rev Light or laser genesis, meron ka pa rin cream. So, ang pinaka-minimal, laging sinasabi ng mga doctors, syempre yung sunblock. Dapat all over the skin na yan. And of course, syempre, before the sunblock, mild wash ka lang. Kapag ginagamit mo yung mga body wash na may mga scent or hindi hypoallergenic, hindi fragrance-free, tapos nagpaano ka, lalo pa magkakaroon ng hyperpigmentation or skin irritation. So if you want the one with fragrance, siguro pang gabi. Or kung if you want it in the morning, gusto mo talaga may scent, dapat di ka magpapaaraw. Nakasama ka palagi. Tapos ang whitening na very mild, if you want yung may konting skin peeling, para lang mag-brighten yung skin mo, you can go for alpha-hydroxy acid, yung mga glycolic na mababa ng percent. Ganun. Tapos, since nagma-micropeeling ka, dapat meron kang good moisturizer afterwards. And bawal magpaara. If you don't like yung mga may micropeeling effect, syempre mo sa mga mild, yung mga niacinamide, vitamin C serum.
Pero Doc, sa inyo, meron po ba kayong mga set or kit na pwede na namin mabili? Okay.
So, gano'n, kompleto siya with the alpha-hydroxy, may sunblock na siya, may mild wash na siya, and then meron kang vitamin C. Yung C ferulic, very effective. May vitamin C, E, ferulic, meron rin siyang hyaluronic. Even sa under eye, pwede siya around eyes. And then, meron kang panggabi. Yung panggabi mo will depend on your activity. So, kung kayang hindi nagpapaaraw, syempre may mga effective na whitening.
Okay.
So, pwede tayong magbigay na rin tayo ng tretinoin, gano'n. Pero huwag mo magpaaraw.
So, mas maigi talaga na mag-consult mo na with Doc.
So, mga milder,
Yes.
meron yung mga plant-based na bakutsol, gano'n.
Para mas customized or personalized sa skin.
Special thanks to Montesa Medical Group, Aesthetic Center, Advanced Dermatology, Age Management, and Plastic Surgery. Timeless beauty, safe and worry